get to that, Mr. President. And therefore, 275 plus 125, actually pwede 400 billion. Now, I did make a proposal. It is not in the committee report, but I understand that the sponsor will accept it as an individual amendment later on. That everyone, and it's the duty of our state, that everyone who gets infected by the virus, health worker or not health worker, shall be covered by the PhilHealth insurance. Is that correct?
Yes, in fact, we have a provision, but His Honor has some clarification,
Yes.
Has language that
Yes.
will make
And-
that maybe clearer.
Yes. So at the appropriate time, we'll make that introduction. Now, so maliwanag na tayo doon. So covered na ng PhilHealth. Okay? And you have 125 billion there. Now, there's still 275. Just for the record, because I read an article today that in the deliberations in the House, there were no specifics of where the 275 will go. Now, so let us put that on record here, that we know what we're discussing here. Now, the 200 billion roughly is for the 18 million families that we will provide subsidies. And the reason why we need to provide them subsidies is because government decided to undertake a strategy of a lockdown. At marami ngayon dyan na wala ng trabaho. And ergo, kung wala silang kinikita, paano sila kakain? And that's why government has decided in these emergency powers to allocate 18 million to 18 million families, roughly 5,000 to 8,000 ang subsidy. Based on the 200 billion, it is an average of roughly 6,000 pesos a month. Is that correct?
That is correct.
Now, equally surprised with Senator Po is that it is not found in the bill, and I understand that the sponsor at the appropriate time will include it in the committee report.
Yes, because that is the request of it seems to be the majority of our colleagues.
Yes, yes. Not only that, but it is good that it is seen
And
there.
it is clearly the intention of
Yes.
government. There is
Yes.
no
Correct,
ifs and
correct.
buts there.
Correct, correct. Okay, now, so that's a 200 billion. Now, just to, and that's for 2 months, huh? Meaning to say, if the problem is prolonged more than 2 months, babalik tayo dito para pag, and assuming you do not leave the lockdown, and we've not licked the problem, babalik tayo dito para pag-usapan additional 100 billion a month for that subsidy.
Correct, but there's a possibility na babalik pa rin tayo even before that because
Economic stimulus package.
Exactly.
Okay, so in this bill, wala pa yung economic stimulus package dito. This is basically emergency powers to address the crisis at hand. Basically to defeat the virus.
To defeat the virus, to defeat the spread primarily, to release the funds that will keep the
Yes.
people at home, and to clarify the to emphasize the urgency in preparing for the medical supplies and the
Correct,
preparations
correct.
that are necessary.
Correct, correct. So that is the purpose of these emergency powers basically, di ba? And to be able to do that, so we've discussed tapos na yung 200. So may 75 pa. Okay? So I would assume that that 75 will be used for what purpose? To buy all these supplies, to hire additional workers, and to purchase certain equipment, and to increase our bed capacity.
You're talking about the additional 75.
No, the 75. Remember you mentioned it's 275.
Yeah. No, yeah, we simply mentioned that
Yeah.
there is easily 275
Correct.
available.
Correct.
So yes, Your Honor is correct since we have pretty much identified that these are the other
Correct.
items that need to be prioritized. It would follow that that's
Correct.
where they
Correct. More or
can
less.
use that more or less.
Okay, now, so finally, let me put it this way. From the very beginning, I've always been saying, as far as this bill is concerned, if it is not an economic stimulus, number one, its first job is to treat our people from the virus. Okay? And number two is to feed our people who are on lockdown. Okay? saka na natin pag-usapan yung economic stimulus with a different bill.
Correct.
Agree.
Now, with regard to treating our people, because I think maliwanag na yung pakain sa tao through that subsidy.
Yes.
Although I think it's a little bit, but nothing prevents the local governments from adding.
Exactly.
Okay? Now, para maliwanag yun in our discussion, that they also have a responsibility.
And in fact, I believe that many of them have been doing that
Correct.
right now
Correct.
for the past week.
Yes, especially in Metro Manila because they have so much resources. But
And
not
and
necessarily...
the lockdown happened in Metro Manila
Not
at
only
first.
Metro
they-
Manila, the lockdown today is buong Luzon.
Right. No, but I mean to say Metro Manila was the first that was locked down.
Correct, correct. Now, the local governments in Metro Manila, as pointed out by Senator Lacson in our caucuses, have more resources. Right? So they can always add to. Okay, that's the point.
They can add.
Correct. Okay, now, finally, in treating our people, why it is important to test? Di ba today the issue is kulang ang test kit? In fact, there seems to be sensitivity about government officials using the test kit. Why? 2,000 lang yung test kit natin. Today, ha? And if I'm correct, my figures tell me that we only have, or since this began, we only use 1,400 test kits. And with that, 400 yung may virus. Meaning to say, roughly 30% ng tinest natin may virus. So kung yung test kit natin maging 10,000, the numbers will show, the model will show, 3,000 yung may potential infected. Kung 100,000 ang itetest natin, potentially, following that model, roughly 30,000 ang infected.
More or less. I mean, I guess it depends where you test.
Yeah,
If you test in
agreed.
areas that have been positive, then you'll probably get
Yeah.
the upper end of that number.
Yes, all I'm just saying is that based on the current figures, that seems to be the rate of testing. Okay? And remember, limited pa lang yung testing natin. Now, why is it important to test? It is important to test so that we know who are infected and we want to reduce the rate of infection, and that's precisely why we have that lockdown. And kung infected ka, we have to isolate you. Is that correct?
Correct.
That is how we are supposed to treat the virus or the patient, right? Para hindi maghawaan. Okay? Now, based on DOH plans so far, in Metro Manila, there are only 3 specialty hospitals with 300 beds. Is that correct? For coronavirus.
I believe they identified like 6, but I don't know if that is a
From what I know, there are 3.
initial 3. Okay, so 3.
PGH, San Lazaro,
Kidney.
Lung Center, and
Lung. Jose Rodriguez
Rodriguez.
is the 3rd.
if you add the hospital beds na for coronavirus lang, it's only 300.
That is also the number I saw.
Correct. Okay, so clearly, if you have, assuming, magra-ramp up yung testing natin eh. I understand we already have 100 testing kits, although mabagal kasi yung laboratory facilities. Okay?
And
But assuming you test that 100,000, based on the model today, more or less 30,000. Posible.
posible.
Okay? Meron yan. So clearly, 300 beds will not be enough. That's the point I'm driving on.
And it is a point well taken because it is an issue that I have been discussing with
With the
DOH.
Correct, correct. Okay?
Beyond hospital beds would be the makeshift, the alternative
correct.
accommodations.
Correct, correct. And that's just Metro Manila, 300 beds. Wala pa atang na-identify in the regions.
As I mentioned,
And
that is
in
a
fact-
point that I have been raising.
Correct, correct, correct. Okay? So, no, I'm only taking this opportunity. I'm sure that the sponsor is aware of this issue. I'm just taking the opportunity to put these issues on the floor, to call the attention of the DOH, and since the economic managers are here, that there is a big gap in the plan as far as ensuring that we do not spread the virus, reduce the infection rate, and be able to treat our people, because the economic costs are tremendous. Not to mention, if we fail in doing what we have to do, masyadong marami yung mamamatay.
Mr. President, I agree wholeheartedly with the gentleman from Batangas.
Yes.
I believe that, and I think this was also resonated by the gentleman from
Olongapo.
Olongapo, that we need to have a plan. We need to know where we're going,
Yes.
because
Now-
the hospitals are not sufficient.
Correct. And based on our conversations, the collective minds of this chamber, if you read the committee report today, mas maliwanag na what to do. So the key now is implementation.
Yes. I believe that is what our objective is
So,
in
hindi na
passing
tayo-
this bill. Not just
hindi na
the
kulang.
not just the funding, but also identifying.
Identifying.
Yes.
And we belabored those points.
Yes.
Okay? Now, one last reason pala why the private sector, incidentally, I've always said that this is not a total government approach. It should be a society approach. It is the public and the private sector working together. Kaya hindi pa pwede lagi yung take over. Why not has government and the private sector, halimbawa, let's say the owners of the private hospitals and the DOH leadership, nag-uusap ba yung mga yan?
Nag-usap pa daw kayo? Oo naman daw po. Every day.
No, I heard pareho daw ating tinanong natin dati. So, but that's the point. That's the point. The point is the public and the private sector should be talking together, like how this is being addressed in many liberal democracies in the world today.
Well, I'll go beyond that. I'll also go into ferrying the health workers.
Yes.
You know, you can give jobs to these
Correct.
jeepney drivers by instead of squeezing 20 people in there.
Yeah.
You can have 6 or 8 health workers, give them a job, ferry them.
Yes, and just for the record, finally, so that I don't take so much time from this chamber, no, and I'm sure that time is late. Unfortunately, I was not able to introduce this as an amendment, but I think that government could also make an accounting or an inventory of, let's say, all our gyms nationwide, public gyms. May shower na yan, may banyo na yan. Among others, as possible areas where you could increase your bed capacity.
I
for
agree.
Possible patients.
There's not really much
Halos-
choice.
Correct. So sa dami ng syudad, sa dami ng multipurpose gyms, na pwedeng gamitin din yan.
And they
Lalagyan
were
mo na lang
really,
ng
and they were,
mga yan.
in the last few years, they were really
Yeah.
designed to become possible
Yes.
evacuation.
And I'm sure that we all know that in Wuhan, when this happened, the Chinese government took them only 2 weeks to build additional hospitals. But basically, those additional hospitals were just like multi-purpose gyms with beds
Yes.
and some equipment. So having said that, I hope that the DOH would have a target of how many beds would be lacking based on the model. Now, not to scare anyone, but in New York today, or in Italy, or in many other jurisdictions, their models show that, and that's what flattening the curve is all about, right? Is so that hindi bulto ka agad na half the population get infected and half need to have health services. Right? So they want to spread that.
Yes.
No? And finally, there are many responses to this crisis. Korea did not do a lockdown, but what did they do? Test, isolate, and cure. Wala silang lockdown. Now, China did everything. lockdown, test, isolate, and cure. Lahat ginawa. Mas costly may lockdown. Now, in the Philippines, I hope hindi tayo tumigil sa lockdown. After the lockdown, let's test. So hopefully with this, more testing units will be arriving. We would be able to provide also our healthcare workers more equipment to protect them. Then, once tested positive, isolate. Para hindi na makahawa ng iba. And then cure. So I just wanted to make those manifestations and put them on the record. And again, let me congratulate the sponsor for putting this bill all together in a proper manner, laying out the plans and policy properly, and the next is just execution, Mr. President. Thank you very much.
Thank you.
All right, Majority Leader.
Mr. President, I also share the same sentiment, Senator Recto. I'd like to thank DOH, especially Yusek Domingo, for accrediting 8 test kits in the last few days. Pero ang problema, Mr. President, is the hospitals that can process those test kits. And I echoed my sentiment to Yusek Domingo to hasten the accreditation of those hospitals, because those hospitals will in effect decongest RITM. So, Mr. President, moving on, I am in receipt of 2 letters from Senator Marcos and Senator De Lima expressing their opinion on the said matter, Mr. President, and would like to insert this into the records, Mr. President.
All right, so inserted.
So, Mr. President, no other senator has signified intention to interpolate. May I now move that we close the period of interpolation.
Hearing no objection, the period of interpolation is closed. This is a substitute bill. We will probably have to go to
Right.
individual amendments instead of committee amendments.
Correct. The bill is a substitute bill. I now move that we open the period of individual amendments.
All right, any objection? Hearing none, period of individual amendments is open.
Mr. President, I move that Senator Pia Cayetano be recognized.
The sponsor, Senator Pia Cayetano, is recognized.
Mr. President, I need a few minutes to prepare, so may I ask for a few minutes suspension?
All right, session suspended.